asked me if I would accept this honor. I went, wow, I said, that's Al Myas's charity. And Al's been, I knew this since 1983 when I started working with Al, and I knew how special it was, but I didn't know what the bridge was about. I had no clue, no clue. And Ann Hyatt, God love you, Ann, you relentless, brought me up there and showed me around the headquarters and made me understand as a New Yorker that the people you walk by on the street and you wonder, like, what happens to them? You know, like you look at them and you say, this person is obviously sick and in need of help. This person needs attention. What happens to these people? And what happens to these people is the bridge. And there is a staff of caring, concerned, professional people that take care of people that need help.
Good evening. I'm U.S. Senator Kirsten Gillibrand. I'm sorry I couldn't be there with you tonight, but I wanted to extend my congratulations to Cynthia Wainwright, being honored with the Curtis Berger Award. Cynthia Wainwright is an extraordinary person who has made a major positive impact in New York through her hard work, good deeds, and philanthropy. Cynthia has nonstop energy for making the world a better place. Through Cynthia's 30 years on the Bridge Board and her 20 years as Bridge Board President, she has led the Bridge through many transitions and much growth. The Bridge was started in 1954 by a group of 10 mentally ill clients and now serves more than 2,300 seriously mentally ill clients with schizophrenia or bipolar disorder. Cynthia had a great deal to do with the growth of the Bridge, from the decision to provide housing to clients, to the addition of new clinical and vocational services, to expanding housing from Manhattan and the Bronx to Brooklyn, to growing and inspiring the board of directors to co-chairing the capital campaigns that financed our headquarter buildings. Congratulations, Cynthia, for your strong leadership and dedication for the past 30 years.
All of you for joining our celebration. 60 years. Imagine the beginning of the Bridge in 1954. A group of mentally ill patients discharged from a psychiatric hospital with, as I always say, big bottles of pills, appointment slips to renew their prescriptions at a local hospital, but with no support waiting for them in the community. A group of patients, enterprising as they were, they started the Bridge as a self-help group and successfully reached to a group of volunteer donors so that they could lease a space for their brand new venture. 60 years later, that original self-help club has become one of our city's most important, most comprehensive recovery-focused agencies for men and women with serious mental illness, including those with co-occurring substance abuse and the homeless. While our numbers are impressive, we provide services to 2,300 people in more than 50 programs in Manhattan, the Bronx, Queens, and very soon, Brooklyn. Clinical services, vocational programs, healthcare, creative arts programs, urban farming, housing for 737 of our clients, with an additional 7 projects in development that will add another 300 beds, and we'll be at a total of 1,044 beds when the current development is complete. But it's really not the numbers that count. It's what we do for our clients, offering each one an individually tailored service plan so that they can achieve their dreams. The thrill of the bridge is when clients share their dreams with us, and when, through their hard work and hours, they achieve them. And with the support of events like tonight's, we've been able to develop innovative programs without government funding. Going back to 1983, when we were the first community agency to go into city shelters to identify and work with people with mental illness. And when we developed the first residence in New York for older people with serious mental illness who also have serious medical conditions, allowing them to live in the community instead of much more costly nursing homes. Our innovative work in creating urban farms at our residences, our wonderful partnership with the Museum of Modern Art, a unique program in which we have a team that reaches into state prisons to identify those nearing release who need housing, mental health, substance abuse services, working with them until their release and providing them with specialized supportive housing and services after they're released. So how does all this happen? Well, with an outstanding, extraordinarily talented and dedicated staff, many of whom are here. And then, of course, there are our clients, the true heroes and heroines of their lives. It's their motivation, their strength and determination that we as staff experience every day, that we are amazed by, and that motivate us. Very grateful for this award and for your kind acknowledgement and your participation.